Susan, are you there?
She might be en route down to the first floor there, Joe.
She was down there. Okay, I got you. Thanks.
Hi, everybody.
Oh,
It's the live Jody.
I'm alive.
Felt like we were looking at the cardboard poster.
She only tries to be as awesome as I am.
Gotcha.
The chairman text you in just a second. He's at home. He'll be online in a minute.
Susan, you may have to do that for Commissioner Tester as well.
I will do it right now.
Thank you.
Sure thing. Yeah.
We do not have a commissioner in the conference room, so I'm going to turn mine and Kathy's camera off. If I can. So you're not just staring at a flag.
Okay. I don't think Commissioner Ford will be with us this evening. All right, it is 6:03. Do we have everybody on, Susan, you think that's trying to get on?
We have a couple that are still hanging out there. Let's give them a couple more minutes if you're okay with that.
Okay.
Commissioner McAllister let me go to spam. So he will be joining us in a second.
Steve Light.
Join the meeting.
I currently have 8 commissioners in the meeting, Chairman, and we're waiting on Commissioner Malone to arrive home.
Thank you, Susan. Is Commissioner Tester on?
Commissioner Tester is not on.
Did you send him a new link?
I did ask him to check his spam or his junk mail.
Yes, for some reason, that's where it went to mine. I just got on.
Susie Williams. Join the meeting.
It is on.
Who's your partner? Ah,
Kristen, hold on to that dog so it doesn't run out the door tonight.
No doubt. She's wallering me to death.
see
It's
her.
like mine too.
Come here. Come here. Come here. She's gone.
No interest.
Not listening very today.
It's not on, so I'm gonna. text it to me.
Chairman, this is Commissioner Harris. Can you hear me?
Yes, I can, Commissioner Harris.
Oh, okay. Are we having a meeting tonight? I'm just picking up a lot of static. I didn't know.
We are. We're just having a couple of little snags of getting people logged on to the meeting this evening. We'll be ready to start here in just a minute.
Okay,
That'll-
that's good now.
We shouldn't be much longer at all, should we, Susan?
No, sir, I'm texting Commissioner Tester right now the information to call in.
Okay, thank you.
And I think, Mr. Chairman, with 9, you have a quorum plus the chairman.
Yes, we do. So we're ready to go ahead and get started. I was just wanting to give Commissioner Tester a second. He's been trying to get on for a little while, I think.
Well, and I wasn't rushing you. I just wanted to be sure you had that.
All right, he should join us here shortly. I think I see him now. Is that you, Commissioner Tester?
Yes, Commissioner Matherly.
All right. Well, thank you. Well, without any further ado, we'll go ahead and call this meeting of the Board of Washington County Commissioners session. And it is Monday, or not Monday. It is Wednesday, May the 13th at 6 p.m. And we'll go ahead and call the meeting to order. Our first order of business this evening will be our prayer led by Commissioner Carriger. Commissioner Carriger.
Thank you, Mr. Chairman. If we will bow our heads. Dear God, hear my prayer. Your faithfulness and righteousness will not fail us. Teach us to do your will, for you are our God. When our spirits grows weak, strengthen us. Amen.
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 Madam Clerk, if you'll call the roll, please.
White,
Here.
Harris,
Here.
Fitzgerald, Edens,
Here.
Davenport, Matherly,
Here.
England, Malone,
Here.
Williams,
Here.
Carriger,
Here.
Jones,
Here.
Tester,
Here.
McAllister,
Here.
Wheeler.
Here.
11 present, 4 absent.
All right. We're 11 present and 4 absent. We do have a quorum. Our next item is the determination of the essential function of the governing body requiring these items on this agenda. Allison, is there anything that you want to add to that?
No, sir.
All right. Do we have a motion to that effect?
So moved.
I make the motion.
Motion made by Commissioner Jones. Was that a second, Commissioner Light?
Yes.
Second, Commissioner Light. Discussion or questions? Madam Clerk, if you'll call the roll, please.
White,
Here.
Harris,
Yes.
Edens,
Yes.
Medley, Malone,
Yes.
Williams,
Yes.
Gallagher,
Yes.
Jones,
Yes.
Chester,
Yes.
Callister,
Yes.
Wheeler,
Yes.
11 yes, 4 absent.
Thank you, Madam Clerk, and the motion passes. Mayor Grandy, if you'll bring us a status update on the COVID-19.
Okay, thank you, Mr. Chairman. We have with us tonight Kristen Minnick, Health Department. She's going to bring us our health update. Kristen, thank you for joining this evening.
Sure. So a quick update about what we're doing at the health department this week. Starting Monday, we resumed several of our services that had been taken out of our continuity of operations plan. So our dental staff came back from being at home, working from home, and under guidance from our regional dental director, they are seeing 4 patients in the morning and 4 patients in the afternoon and following some very strict PPE guidelines. Likewise, our primary care providers, our nurse practitioners, are back in our primary care program as well. And again, seeing some patients, not as many as we typically do, but just people are coming in because they're out of medications and we've not been able to actually lay hands on them for services in quite some time. So part of what, hang on, it's treat time. I'm about over Zoom meetings, y'all. But we are providing services for those primary care patients who are coming back in to see us. Go get David, go. So we're still providing car side services as much as we can too. We're not quite out of that continuity of operations plan just yet. Our target right now to bringing the rest of our staff back is May 26th, unless the governor decides to continue with our continuity of operations for our government employees. So not quite sure what his plans are with that. Again, we see and hear things about the same time that everybody else does. So slowly trying to get back into a normal routine, and then just continuing testing. Today we did 51 swabs at the health department. That number doesn't seem to fluctuate much from day to day. Our National Guard team did get changed out today, so we don't have the same people we've been working with, but these new people are trained and do just as well as the other ones did. So that's really about it for what we're doing as far as work at the local level, and just continue to watch the governor's updates and see if there's any change in what he wants us to do. But other than that, just pretty much the same that we're moving from week to week.
Okay, questions on the health side? Gary?
Kristen, and I've asked this question before, I just want to make sure that, because it's, I guess, how quickly do you get results back on a COVID-19? The reason I asked is because I had someone talk to me today, and they had to go on Saturday. They had to go to obviously I think y'all are closed on Saturday, and they went to a walk-in clinic, got a test, and as of 5 o'clock tonight, they still don't have the results back. So I was curious, how quickly do you get your results back?
So we're seeing our test results come back in 24 to 48 hours now that we have changed lab providers across the state. So that's pretty helpful for people who need a quick turnaround time. From what I understand, a lot of people who are getting ready to have surgery who aren't having that procedure done at a Ballad facility are being told to come to us for testing because we're able to get the results back fairly quickly, because they do have to have that negative result before they're allowed to have their procedure done. There's still just a level of caution with that. Just because you test negative one day doesn't mean that a couple days later you wouldn't test positive, because you developed enough of the virus to be able to show up as a positive on that lab test. So we're doing pretty good with getting them back through our new lab partnership that we have. So that's working better for us and working better for those who are coming to us for testing.
Do you have any antibody tests? Are you doing any of that where to show if they've had it before, or they may have had it?
We don't have that antibody test just yet. Not to say that the Department of Health won't be able to provide that service in the future. There are several antibody tests that are available for either people to purchase or through a healthcare facility, but there are very few of those who are kind of regulated and trusted through the FDA. So I would encourage somebody to really study and be aware of what you're going to do and where you're going to get an antibody test when those become more readily available, to make sure that it is FDA approved. Now, unfortunately, during a time of emergency is also a time of people trying to take advantage of others who aren't quite educated or understand what they might be purchasing. So we're always on the lookout for those scams that could be going on. Just like we saw scams with COVID-19 test, there will be those same types of situations with antibody testing as well.
Thank you.
Mm-hmm.
Okay, other questions? Chris, you might want to just talk a little bit about the mask program and how that went.
Okay, so we have seen in the media where the Department of Health all across the state has received from that place in Cleveland, Tennessee. Those masks were shipped to us last week. Washington County received 20 cases. So that was approximately 7,000 masks, and we are already out of those. This past Monday, we received an additional shipment of 7 more cases, and when I checked before we left today, we had about 2.5 left. So people are coming to get those. Again, these masks are not meant for clinical use, but it is a good face covering for those who are going to be out in public and want to protect their germs from getting to somebody else. So we shared some of those with UT Extension partners so they can help get those out to the schools a little bit better than we could. But other than that, it's mostly just been families and church members coming by to pick up masks for themselves or for their neighbors or for those who are in their congregations, just preparing, trying to be a little bit safer as they're going to be out and practicing social distancing with that mask on.
Yeah, so we still have a few more available if you need them, right?
We have a few more available. Not sure if we're going to get another shipment. I haven't heard anything but that information comes a little bit last minute. We'll hear one day that we're going to get a shipment, and it usually shows up that day or the next day. So since we got these 7 cases on Monday, I haven't heard anything else about getting any more.
Positive cases in Washington County still mid-60s or so.
They are. I think I did send you, Mayor, and some other information to Rusty and to Mayor Brock regarding a case that will disappear from Washington County. It'll be one less case probably in the numbers that were reported today. Some people, when they're being tested, are showing to be positive for coronavirus, but it's not the COVID-19 strain, but yet it doesn't look like it matches any other type of coronavirus strain either. So they're just considered a probable case through the definitions of the lab that we're utilizing. So you may see a fluctuation in numbers of one person in Washington County from yesterday to today's report. But we're staying pretty steady with the case numbers that we are seeing, not really seeing a whole lot of spike in those numbers, which is a good thing, but that doesn't mean that we're out of the woods and that we should not continue to practice those public health recommendations that we've been asking people to do from the beginning of the outbreak. The last thing that we need to see is people getting relaxed and too comfortable, because at that point in time, they're going to be more likely to spread the infection, and especially if they don't know that they have it yet. So that's something to be aware of.
Okay. Well, you're going to stay with us a few minutes in case somebody comes up with a question. Okay,
Sure.
thanks. So we had a little bit earlier this afternoon, call with the governor's office, updating their plans and what they're doing. So they're still in business reopening phase 1, which is intended to continue pretty much until the end of May. They were able to say that Tennessee is among the top 3 states in the nation as far as being aggressive business reopening, which that's really encouraging. And in order to be able to do some of the things that the state's doing, the state of Tennessee is among the top 10 states in the nation in the number of people that have been tested, and it's in the bottom 10 in the number of people that have died from corona. So, both of those things have allowed Tennessee to move forward with business reopening, which of course we desperately need. One of the things that is not yet going that probably most of us have had at least a call or two about, and that's youth sports and contact sports. They are going to take a look at they being the state of Tennessee and their medical folks that are working on that are continually evaluating the data every single day, and will be considering opening up youth sports June 1st. But as of today, there are no youth sports programs supposedly being conducted anywhere in the country. So we're not different. It's just it's a time of year to play Little League baseball and do things like that, and it's very difficult. We did get some information today that I don't have a lot of detail on it yet, that we're working on a protocol for sports conditioning in the local high schools. That's not practice, that's not contact, but it is, it is conditioning, maybe weight training and some other things like that, that will help the athletes prepare so that when they're able to go back to practice, they're a little more ready for that. Probably the big message from their perspective is encouragement in the local community, and that's probably where all of us play a role as leaders to support this Tennessee pledge, which is the business protocol for reopening, maintaining the social distancing and the other health guidelines that have been outlined. I'll have to say that we were a little ahead of the curve. They just announced a program that we actually have been doing for about the last 2.5 weeks, communicating with local businesses. We have our own placards that indicate that the business is compliant with the Tennessee pledge, an initiative that Gary McAllister has had a big hand in, and Gary, I want to thank you for that. It's sort of interesting sitting there listening to these ideas come out of Nashville with all the smart people that your task force had implemented about 3 weeks ago. So, that was sort of interesting to listen to. But the point is to give folks a sense of confidence when they come out of the community, particularly those that are elderly, that they have a place to go that's practicing safe health measures to the best of their ability. And locally, I don't think this is part of the state's program, but locally we have a website where people can go, where businesses can go first to register that they are in compliance with the Tennessee Pledge guidelines. and that they're a safe place to visit, to shop, and to dine, and so forth. And their website also affords an individual who may want to find a restaurant that meets these standards or a business meets these standards to shop. They can go there and see what businesses have complied. So I think, we're well ahead of the curve. Several hundred businesses have already signed up. And so, that's given us a pretty good start. And from those businesses that I've spoken with that have signed up, and the business is good, and that they feel like that this initiative is helping. So any way you can get the word out would be helpful. The website is Region Ahead. It's the same website that's soliciting funds to help businesses in the community that may not have been able to get help from the federal government. So that's regionahead.com, and click on the Tennessee Pledge icon. It'll take you either right to the businesses that have already signed up, or a business owner can go there and register their business. We have window stickers, we have yard signs, we have indicators that would tell someone approaching one of those businesses that they are in fact in compliance. Courthouse operations will be considered next week. What date we will exactly be reopening the Story Courthouse to general traffic. Again, today all operations of county government are functioning. They're just functioning in a little different way with less face-to-face contact. We made some modifications to the customer-facing areas in the courthouse so that when we do reopen, there'll be some protection for our employees, which is really the most important thing. And so, through the process, all of our, I think we have no positive cases in county government as of today. From the state, they were talking about opening local theater and theaters and stage productions, music venues, that sort of thing. They are considering allowing local government to accept a plan for theaters that may want to open, as to how they would maintain social spacing and so forth, and turn that process over to the local entities a lot more than what we have seen in the past. As you know, all the guidelines that we're currently under are state mandates. So with that, I guess I would just say one thing. Yesterday we had, one piece of good news. There's a lot of crazy stuff going on out there, and there's a lot of concern, but we had a company relocate their corporate headquarters from Jacksonville, Florida, to Washington County, and it's a business that we actually utilized here in county government to help sanitize our space. It's called BioPure Services, and with them a TV production company called Rugged ETV University, and they have several buildings actually in Johnson City that they have purchased and opened and will be established here. And in fact, this week they had 15 franchisees from all over the country here for training. Had a chance to meet with some of those folks yesterday, and this is really going to be a good business for our community. They've required nothing of us other than a community where they can grow their business. And so we believe we have that. And so for what it's worth, that's the second corporate headquarters relocation that we've been able to celebrate this year. You may recall earlier in the end of March or April, LabCorp relocated was in the process announcing that the relocation of their corporate headquarters from Seattle to their facility in Johnson City. So a number of new jobs and a couple of new companies here. It's always good to get a corporate headquarters in town. So with that, Mr. Chairman, I'll either answer questions or just be quiet. Thank you.
Thank you, Mayor. We appreciate the update. Thank you, Kristen. Did anybody have any questions for the mayor or Kristen before we, Gary?
Just a quick comment to all my fellow commissioners out there and everyone online. The mayor mentioned the Region Ahead website and the Tennessee Pledge. If you haven't had a chance, I would strongly encourage you to go check that out. I've been to any business I go to, I try to talk to the manager or the owner, and I say, are you familiar with the Tennessee Pledge? Or do you know if you follow on that, you can get your business on a website. Some were somewhat familiar with it, some were not. And once I talked to them, they're all very, very receptive and wanted more information. I shared the website with them, and I said, let me know, and we'll get you. I've gotten one person call me back, and I've got a sign out to them that the mayor can provide to you, show them that they're compliant. So the businesses are extremely receptive, and I would encourage you, if you go out to a business, to talk to the people about that. It helps get the word out.
All right, that's good to know and good to keep that in mind. With the mayor, I was glad to see BioPure's relocation. They've been a great service for the 911 center. We've relied heavily on them during this time, and they've been great partners to work with. Is there any questions from the commission or comments before we go? Commissioner Malone?
Maybe just a couple of questions, but first of all, Kristen, am I to understand, I guess, that Washington County, we're thankfully down to just 5 active cases? Is that correct?
Is that from the report that came out today?
I haven't seen the one today. I think that's what I saw yesterday.
Yeah, I don't think anything has changed necessarily today. I didn't read that before I left today, but should be winding down some of those cases, those active cases.
Thank you. And Mayor, I'm glad to hear not only about BioPure, but the fact that they hosted folks in town, but that does seem unusual in light of what's going on and in terms of lodging and food and beverage. I hope that they were adequately served.
Well, they were at the Carnegie and seemed to be in pretty good spirits, actually.
Yeah. That's all I have to.
Commissioner Jones?
I'm thrilled. And actually, they took a space right around the corner from my house. So I was heading out yesterday and saw all these people there, and it was a really crowded group of people standing on the sidewalk for this event. And I had a number of neighbors text me that they had observed that none of the 40 or so folks that were crammed on that little piece of property were wearing face masks or social distancing or doing any of those things to take this pledge and follow these rules, and we ought to be following them ourselves.
Well, I just say that I had my mask on.
Well, Jenny had hers on it right there on the newspaper, but I think you might have been the exceptions in the crowd that were, at least what I could tell from my little drive-by. And again, I don't know how that all evolved, and sometimes we don't have control over exactly how things get set up. Things happen, and again, just be aware that I did get quite a few comments made to me about it, and folks are noticing. So,
good advice.
That's well spoken, Commissioner. You're exactly right, and it's something we all have to get used to, wearing that mask, and it's I'm right there with you. All right. Any other questions, or do we have a motion to adjourn?
So moved.
Motion made by Commissioner Carriger, seconded by, was that a second, Commissioner McAllister?
That's the second.
That's the second. All right. All right. Madam Clerk, if you'll call the roll, and we'll adjourn.
White,
Yes.
Harris, Edens,
Yes.
Matherly,
Yes.
England, Malone,
Yes.
Williams,
Yes.
Carriger,
Yes.
Jones,
Yes.
Hester,
Yes.
Callister,
Yes.
Wheeler.
Yes.
10 yes, 5 absent.
10 yes and 5 absent. The motion passes and we're adjourned. Thank you all so much.
You.
And we'll
Thank you,
see you
Mr. Chairman.
Monday.